It's no surprise that losing weight is on the top of most people's list. But what can you do when exercise and diet don't seem to work? In the past, we would chalk it up to just simple aging. Today, we know different. Sometimes weight gain can be a symptom of other problems. In other words, gaining weight is not always because of something you're doing wrong. Here is some answers. Please welcome Dr. Drshelenalaljiaesthetics and her patient, Rhonda George. Hi. It used to be we just had to take it as it came, and we'd say, right, you're just getting older. But now we know why the body starts to age.
You're right.
And we can help fix that.
Yes, we can, Deborah. There are so many things that are going on as we're aging, as we all know. One of the primary things that are going on is our hormones are declining. Our nutrients are declining. Our food sensitivities are going on. And so all of those things together begin the aging process and just rapidly continue it.
And when they're declining, boy, don't we feel it. Although we might not be able to identify it, we feel it. You started feeling it, Rhonda.
I did. It was just not right. Yeah. I knew I wasn't right.
Give me your symptoms.
I was tired. I was over-emotional. Things that would normally be no problem, no big deal, was just overwhelming. Yeah. Everything just seemed just too much. Yeah. Too much. And it just wasn't right.
All the time. And you'd be tired, but even though you were so tired, when it came time to go to sleep, you couldn't sleep.
Not sleeping.
Yeah.
Just tired, exhausted.
Yeah. So Dr. Shel, we know that also when we can't sleep, then, you know, and we're tired, weight gain sets in, all kinds of things. We saw a picture of you earlier where you were 50 pounds heavier.
Yes.
Wow. Okay.
Yes.
So when you hear those symptoms, what's the first thing that comes to mind for you?
Hormones. Hormones, thyroid, as well as balancing all the nutrients. So the first thing that I like to do, Deborah, is, of course, we don't just want to jump into a medical weight loss program. We want to fix what's going on first. We want to see if the cortisol's rising, is the adrenal gland working well?
Because if you don't see if that's working well, then you're going to fight an uphill battle. Your body's going, sorry, not dropping any pounds.
That's correct. And even if you go on this crash diet and lose a few pounds, it doesn't matter because it's coming right back. Yeah. And you go into this yo-yo mode. So you've got to look at what is the basis for all this that's going on. Balance that thyroid so your metabolism is good. Balance that cortisol, make sure that your adrenals are working, and balance your estrogen, progesterone, testosterone, DHEA, melatonin for sleep.
Which all that was the issue that Rhonda was dealing with. All right. So once you balance that, then you are on your way to losing the weight. So that encouraged you to make other changes in your life. As I was told with my thyroid, it's like if we give you the thyroid, that's not necessarily going to make you lose the weight. Correct. But what you do is now going to count.
That's correct.
It made such an incredible difference. It was the best Christmas gift that I gave to myself last year. Yeah. Just going to see Dr. Shel and her beautiful staff, and they made an incredible difference in my life, and I love her so much.
You're emotional.
I am.
Because you feel so much different than you did before.
Incredible. Yes, I am very emotional.
But by the way, you saw her a year ago on this show.
It was a year ago. She was on this show. I was on my way to go to see my physician for antidepressants. I was like, something's just not right. But when I saw her on the show, I'm doing that first.
Yeah, you said those are my symptoms.
That's it. I'm doing that first. I'm going there.
So you started losing the weight. You lost 50 pounds. You went to her open house to find out about all her services. Yeah. You lost the weight. We saw that before picture where you're 50 pounds heavier. And at the open house, you made up your mind at that point, too, that I get the outer self fixed and the inner self fixed. I can do all of that under one roof. So you got the hormones balanced. That's how you were able to lose the weight, get good sleep, emotionally right the ship, if you will. And then there were some other things you started looking at, and because you have full services there. So you're looking in the mirror going, Yeah.
All right, so once you start feeling better from the inside, then you want it to show on the outside. And and then that's what Rhonda did.
Let's talk about some of those non-invasive procedures like the liquid facelift, Dr. Shel, which can combine a number of things, Botox and fillers, so we can get rid of wrinkles, we can get depressed spots like those smile lines, and we're looking at some before and after pictures of just kind of how you can soften the face.
Exactly. So this patient has had a few things done. She's had Juvederm around the lips to take away those lines around the lips. She's had Radiesse done around her cheeks as well as her nasolabial folds, And she's had the Titan skin tightening procedure.
Talk about that procedure.
That is a fantastic procedure, Deborah, because there is absolutely no downtime with Titan. It doesn't hurt. It's a procedure that we call it our lunchtime procedure. So you can come in, have it done. It takes about an hour to an hour and a half. Safe for all skin types, and then you leave with your collagen stimulated, and it looks like you've had a mini facelift without any downtime, no surgery, no knives.
How? Okay, so who qualifies for this? When you look at someone's face, how do you tell whether the Titan will work for them, or is it something that they really do need to go get like a facelift
That's
for?
an excellent question. So what I do is I always touch their face and try to see if there's enough collagen elasticity for them. So if you've got somebody who's got so much laxity and so much excess fat, I would say no. But if you've got somebody who's just got some elasticity that's gone, neck, face, lower jaw, chin, stomach, abdomen, arms, legs.
So you use that several areas of the body.
Exactly, you can use it for all those body
If you look in the mirror and you're going like this, and you can see a difference, then maybe you get. But if you're having to go like that, then maybe that's something else.
Yes.
All right. The other thing you have is the pearl procedure.
Yes. The Pearl procedure is fantastic because we all, especially in the city of Houston, go through a lot of sun damage.
Right.
And a lot of us were sun worshippers when we were younger. So you want to do something that takes away that sun damage, improves the skin size, texture, pore size, and just removes all that within one procedure. And this procedure is great because it does all of that in one shot. And you have a little downtime, about 72 hours of what I call social downtime, which means no cocktail parties, but everything else is okay.
Yeah.
But with that procedure, everything's gone within one procedure, and it's fantastic.
How do you feel today?
I think I know the answer.
I can't even describe it. Completely different. The best of my whole life.
Yeah.
The best.
Wow. Okay.
The best.
We have a quick question from one of our audience members for you, if you don't mind. Hi there.
Hi there. From a woman of color perspective, is this procedure safe for our pigmentation?
That is an excellent question. The reason that's a great question is because there's a lot of misperception out there. There are certain lasers, and you have to be very careful. There are certain lasers that are absolutely not safe for skin of color or darker skin types, even like mine. There are other lasers. The Titan is perfectly safe. It is colorblind. There's the laser Genesis, which is a great laser for large pores, skin texture, pigment, to break down the pigment. That is extremely safe in the darker skin type. But photofacials, I would beware of. I would beware of the IPL photofacials, not do those. And when if you're ever interested in doing laser hair removal, make sure the facility is not using an IPL device. Make sure that they're using a 1064 YAG device, which is very safe.
The importance of going to the right professionals and going to those open houses where you can ask questions like Rhonda did. And Dr. Shel has a special offer for Great Day viewers to help you on your way to a healthier and younger looking new year. The first 25 people who call Dr. Shel's office can get $300 off any laser package or $200 off a weight loss or wellness package. And there's an open house tomorrow at the Dr. Shel Wellness and Medical Spa on Highway 6 in Sugar Land. For more information, call them at 281-313-SHEL. That's S-H-E-L, 1L. That works out to be 281-313-7435. You can also find them on the web at drshel.com. Thank you.
Thank you, Deborah.